So just flex, keep back down. Now let's do that one more time. Flex it, keep back down. Now I'm going to ask you to flex your knee and then abduct your shoulder, like lift your shoulders up. Okay, flex your knees and then lift both hands up. Yeah. Now we're just looking to see if there is any, difference. You can put it back down, Carrie, between the two areas. Okay, back down. Yeah, and now I'm gonna ask you to flex your left leg, your left hip. Yeah. Okay, back down. And now flex and lift up your hands. Good. So that is good. Thank you. So we're just starting the common compensatory pattern, just assessing the, the area of ease. Okay. So we have more movement on the right. Again, more movement on your right. Okay. Now I'm just copying around your rib 7 to 10. Your left hip feels more restricted. And now coming down to your ASIS. More movement on the right, less on the left. And that is for a common compensatory pattern. Test your ribcage movement and then you'll turn prone. Now I'm going to ask you to take a deep breath in and out. I'm going to come to your fingers. Now take a deep breath in and out. Deep breath in and out. I'm just going to place my hands on your abdomen. Take a deep breath in and out. One more and out. Here. Take a deep breath. Okay, now take a deep breath in and out. Prone. If you want to turn to your back. Now you're just going to put your hands. Yes, exactly. Thank you. Do I have your consent to palpate on your sacrum?
Yes.
Okay, now I'll ask you to take a deep breath in and out. Of difficulty on this side. Your issue to porosities, just closer to your coccyx. Now I'll ask you to take a deep breath in and out. So with this, the both move evenly. That's it for the pelvic and the diaphragm movement. In temperature. So when I palpate middle back, I find she has lots of tension. So I'm just gonna sink in here for a little bit, and then I will just follow the direction the muscle wants me to go. First, I'll do my strain around the clock. I'll go superior and inferior. Rotate laterally, medially. Okay, I'll go superior, inferior. Our body likes to go inferior, and then I'll go right and left. Our body likes to go right, which is lateral, and then I'll rotate laterally and medially. Our body likes to go lateral. So now I'm going to stack the body according to the direction of ease. So inferior, right, and then lateral. And then I'm just going to stay there until I feel the muscles, just kind of melt into my hands. Or I feel my hand melting into the muscles. This is the direction that the body likes to go, the direction of ease. And now I'm gonna go superior medial, and rotate left. And this is the indirect, this is the side that the body doesn't like to go. So I'm gonna stay there for a little bit. I'll do the same thing on the lower back because she did complain she has some tension as well and some dullness, some pulling sensation on the lower back. So I'm going to be doing the same on the lumbar spine. So now I'll go inferior, superior. I'm just looking for the direction of his, right, lateral, left, medial. The same thing, the same result. The body likes to go superior, lateral, and it also likes to rotate right. So I'm just going to stay there for a little bit. That is all for body temperature, for pores, and also direction of his and direct and indirect position. So Kerry, for our clinical impression today, we're focusing on your lower back. Your lower back tension is significantly influenced by fascial restriction at your thoracolumbar junction and sacrum. And this dysfunction, compromises the stability of your pelvic and lumbar spine, which is alternating, force transmission, leading to the pain, like to the dull pain that you feel on your lower back and mid back. Okay, and for contraindication, there is really no much contraindication for this treatment because you're not pregnant, good, and you've not had any surgery, amazing. And then for my awareness of current evidence, so the reason why I'm choosing this approach is because this approach focuses on your thoracolumbar junction and sacrum, because our studies shows that these transitional zones are crucial for absorbing shock or energy and maintaining overall spinal stability. Okay, so now we're going to get into the treatment. We're going to be starting with the global treatment. The first one is going to be diaphragm release. Okay, if you want to please just lie supine on your back. Thank you. And with the diaphragm release, just put your hand on your chest. Put my hand on your sacrum on the left side since you have issues with the left. And then my other arms, I'm just going to put just on top of your pelvis. And now I'm going to ask you to take a deep breath in and out. And now take a deep breath, hold, and out. Good. So the next treatment is going to be our local treatment, which is hip joint capsule. First, I'm going to put your leg into flexion, and then I'm going to laterally rotate your leg, and then place my hand just on your SI joint. Okay. Relax. I'm just going to stay right there a little bit because I felt a bit of tension just on this spot. I'll wait a little bit right here. Just give your leg a little bit of traction. Thank you. And now we're moving into the third treatment. Kerry, if you want to please roll to your side. So now I'm just going to be doing the labral sacral decompression treatment, which is a focal treatment for the pelvic and sacrum. First, I'm going to be placing one hand on the sacrum, just rocking the sacrum, and then my other hand is going to be palpating between L3 to L5, rocking those vertebrae. Okay. Now I'm trying to create distraction between both muscles. If you can please extend your legs, flex your knees, and now just lift up your pelvic. I'm just going to place my hand on the sacrum, and then my other hand is just going to be palpating L5 to L3. Okay, you can relax. Now extend your legs. Good, thank you. Now I'm just going to wait for the muscles to sink into my hands. before I start the distraction process. Now I feel the muscles sinking into my hands. Now I'm just going to be distracting L4, L5, and L3 superiorly towards the head, and then I'm also going to be distracting and rocking the sacrum inferiorly towards the client's feet while I'm waiting for the muscles to lengthen. Okay, that's the pelvic, thank you. So that's the treatment for the sacrum decompression. Now we're just going to do the thoracolumbar fascial release. I'm just going to place my hand on a ribs, on ribs 7 to 10, 11. And then I'm just stacking. First I sink into the muscles, going down all the way to the ribs, and then I stack in the direction of his. So I'm stacking inferior, medial, and then right rotation. I'm just going to stay there for a little bit. And then I'll come down a little bit, and then I'll stabilize the hip and just place one hand. Again, I sink in to the muscles and to the ribs, and then I stack in the direction of his, which is the direction that the body wants to go. I can also do this on the rib, so the rib is facing an angle, so I'm gonna, do the treatment according to that angle. Just placing my hands on the intercostal space. I can also do the same thing on the QL. So now I'm actually on the floating ribs. The intercostal space on the floating ribs. Okay, I'm just stacking. Okay, and that is the treatment for the thoracolumbar fascial release. So we're done with the treatment, local, focal, and global. Now we're just going to reassess to see what benefit we have for Carrie after the thoracolumbar fascia and sacrum release. Okay, so Carrie, I'm just going to look for your PSIS, and then place my hand on your HES2, and I'm going to ask you to flex your hip. Good, back down. One more, and now raise your shoulder. That is still even. Of course, you can put your hands back down. The stock test we did initially was neutral, was negative. You can put your leg back down. Good. And now I'm gonna do the same. I'm just gonna tilt you a little bit. Okay, for the other side. Okay, if you can flex your left leg. Good, back down. And now flex your leg and raise your shoulder. Lift your hands up. Good. You can see it's still neutral. So stock test is negative. That is good. Okay. After the read, we get to your end range. Good. I can see the movement is now even on both sides. Lifting up your right. Lifting up your right. Now we have almost equal movement. We still have more movement on the right, but the movement on the left actually improved a lot. Yeah. And now, let's try this. Take a deep breath in and out. You have like way more movement. So while I'm standing here, I'm just gonna do this as well. Now take a deep breath in and out. Let's see. Yeah, you have more movement on your left now. Okay, take a deep breath in. Relax. Take a deep breath in. Relax. Good. So I find your breath on that side is pretty good. Coming this way. I'm just going to ask you to take a deep breath in. Relax for a little bit. And I'm just going to ask you to take a deep breath in. Relax. One more time. Relax. Good. So almost all the texts that were positive in the past, they are now, some of them are even, while some of them are negative. Okay? I think that's everything. Okay, so if you want to turn prone, right, can you?
I have to tell the kids to keep it quiet a little bit.
Okay. So now we're just gonna palpate for the sacrum, for the coccyx. Carrie, I'm just gonna ask you to take a deep breath in. Relax. One more time. Relax. Okay, initially we find that you were, pulling towards the left more, but now it's pretty even. If you want to do that one more time, relax. Good. And now we're just going to do the ischial tuberosities. Good. The table is moving. Okay, now I'm going to ask you to take a deep breath in. Relax. One more time. Relax. Good. That is also moving equally. So that's it.